Hi there, my name's Sophie Mullins and I'm a medical student, and I'm here today at the Leicester Royal Infirmary at the Clinical Skills Building to introduce you to the simulations that form part of the Epiphany project, run today by Dr. Rakesh Patel. And the Epiphany project is a project that is being funded by the Health Education East Midlands, who are formerly known as East Midlands Health and Innovation Education Cluster. And we wanted to introduce you to what simulation involves. So we're going to take you around today and we're going to meet a couple of people who are on the simulation. So if you'd like to follow me, we'll go on through. So once the junior doctors arrive, they'll come through this area.
Thanks, Sophie. Hi, I'm Krupa Samani and I'm also a medical student working on the project. So our first stop will be the admin office, and this is where the participants will come initially to complete their consent forms and any other paperwork that's necessary. A point to note is that this is a voluntary project for them to take part in, and it offers the opportunity to practice a skill that's not formally taught in their postgraduate training otherwise. As you can see in this area, we have Dr. Ming Lim and Dr. Will Green, who are academics at the University of Leicester School of Management, who will be assisting the participants in this area.
So we've just come through to the 4-bedded ward, and this is where the simulations will take place. So if you'd like to just follow me and I can introduce you around the bay. So this is John's bay, and as you can see we've got some notes and we've got a drug chart and all of the paperwork that would normally be present if you're on the ward. But there is a twist in that the candidates will be being filmed. So in the corner you can see a camera nicely positioned on top of the sliding scale, and over there's another camera, so there are multiple views that can be got of the participants as they're going through the simulations. So if you'd like to come over to the next bay.
Go into this bay and just meet one of the patients, so if you just follow me through to the end. So we've got Barrett in this bay, and here we've got Margaret. Hi Margaret, how are you doing today?
Really hurts, my leg really hurts. I'm hoping somebody's going to come and sort it out soon.
Yeah, well hopefully you should have some doctors coming and having a look at you. So as Margaret's said, she's here today because she's got some pain in her foot. Again, the setup of the ward is just the same. We've got the notes. Here we've got our nurse Colette who will be helping with the patients.
So we're just going to introduce you now to the observation area, and that's just this area over here. As the doctors are being filmed, the filming needs to be collated and they also need to be analysed as they're doing it. And that's all done behind these curtains here. And you can see that there are multiple people and laptops set up. Would you like to give us a wave? So in order for the doctors to be debriefed properly, they are recorded and filmed, and all of that information is put together behind us. So if you'd like to come through.
Okay, so here we are in the handover area where the participants will come once they've finished their ward round with the patients, and here they can use the laptops to update their handovers, noting down any jobs that they've completed and any other tasks that are outstanding. This is all in preparation for the board round, which they will do with a senior doctor, and I'll show you through to where that is now.
So now we're coming through to the board round area, and the simulations are going on at the moment. But after they're finished, the doctors will come through here and have a handover with a senior doctor. So if you'd like to follow me. So they'll come through and they'll have a handover, and during that handover they'll go through each patient individually and discuss any acute management, any prescribed treatments that they might have given, how they prioritise the workload for each patient and as a ward round as a whole, and any paperwork or jobs that there might be left to complete. And this interaction will also be filmed, so the doctors will have been filmed throughout the simulation, and those filmings, they'll also be transcribed, so they'll be given a written transcription of what happened, and they will have also received feedback during the simulation, so it really offers a 360 analysis for them as to what happens. And once this is finished, that will represent the end of the simulation for the doctors, and it's also the end of the tour. So I hope it's been useful and given you a taster of what is involved on a simulation day, and thank you very much for watching.
Just to finish off, we'll just see what some of the participants thought having gone through the simulations today.
I think on a general ward it's quite realistic.
Yeah.
And the patients are very clued up, which is very realistic according to renal side of things. So I guess on the whole it's pretty realistic. And the fact the nurses are jumping in and out saying, can you do this, can you do that, that's pretty realistic.
I think it's a useful learning experience because you're sort of testing how much you think you know and how much you can do on your own without seeing you.
Yeah, for sure, yeah. I mean, at the end of the day, if it's a real patient, it's a real scenario that you've been in before, that's can be a lot more realistic than anything we can sort of make up.